Hormones, they get a lot of attention in the wellness community, and this is for good reason. They circulate the body in only minuscule amounts, but they are powerful, they're complex, and they're wide reaching. These chemical signals are one of the main forms of communication between different organ systems. That's a big deal because we know what happens when communication is effective and when it's not, right? It's Dr. Sarah, and today I want to discuss with you how hormone regulation impacts physical health, mental health, and mood. So, we're going to go over some of the systematic effects of hormones, how hormones are regulated, specific relationship to hormones and mental health and emotions. And then I'm going to talk about why a holistic, integrative, naturopathic, and functional medicine approach is the best way to achieve hormonal harmony rather than just specifically using a hormone as a treatment without addressing the underlying cause. So, any references that I talk about will be in the accompanying article, and the link will be in the video description. So, if you want to dive more into the research or you just want to learn more, go ahead and click the link that will be in that video description, and it'll all be there for you. So, first of all, let's talk about the mind body systemic effects of hormones. So, the endocrine system uses hormones to control and coordinate many interactions in the body. These include things such as metabolism, and that includes maintaining homeostasis, which is a balance and coordination between blood pressure, blood sugar, temperature, cellular energy, basically how your body functions on a day-to-day basis that you don't even think about, but that it's doing in the background. It's also communicating signals for reproduction, for fertility, for sex drive, for growth and development. Anytime there's an injury, a stressor, an infection, or an environmental influence, that's signaled by hormones. And of course, mood. So, due to the impact, which is obviously far reaching, these tiny chemicals are tightly regulated in their production, their transport, their utilization, and how they're removed from the body. And another thing to keep in mind is that hormones are very specific. This means they only communicate with the receptors that welcome their signal. So think of hormones as opening the lock to enter their target tissue. They're like a key, right? And the organs are very picky about what they're going to let into their systems, kind of like how you would be picky about who you let into your house. So, how do hormones specifically regulate and control and communicate with the body to address all of these different functions? They do it in two different ways. And one way is this kind of telephone game. If you've ever played that game when you were little, where one person says one thing, they whisper it into the ear of someone else, and it kind of goes down the line. And by the end, you see how accurate that person says what the first person says. Hormones have kind of a similar way of communicating, but it's really important that the messages are heard clearly and concisely. So, what happens is that one gland releases a hormone that influences another gland's hormonal output, and it causes a feedback loop. So, an example of this would be your hypothalamus, your pituitary gland, and your thyroid gland. They all connect in this kind of telephone like manner. First, your hypothalamus, which is a gland in your brain, releases thyrotrophin releasing hormone, or TRH. This then stimulates your pituitary gland in your brain to let out thyroid stimulating hormone, or TSH. And then the TSH travels to your thyroid gland in your throat, and that causes it to discharge its thyroid hormones. And the result of this chemical game of tag is that thyroid hormones finally enter their circulation. They reach their targets in various locations in the body, and then they have their many different effects all throughout the health aspects of what helps our body function and our hormones and all of the different things that thyroid hormones do so well. Now, when the body finally has it's full of thyroid hormones, the feedback loop stops. and the hypothalamus stops pumping out thyroid releasing hormone. So it's almost like there's like this three-way or two messages in between when your body's going to release thyroid hormone. It needs to hear the signal first from the hypothalamus, then the pituitary to stimulate the thyroid, and then the thyroid actually releases the hormones. Now, the stress response actually occurs in a similar manner. You've probably heard of the hypothalamic pituitary adrenal axis, and that's a term often used to relate this link in connection and communication. And it's likely on online summits, you've heard people refer to this when they're kind of talking medical jargon about the role of the endocrine system in the stress response, because your adrenal glands, which are located in your lower back, are right on your kidneys. Those actually secrete out stress hormones and the hormone cortisol, which you might have heard about. Cortisol is a very important hormone, and the effects of the hormone cortisol and the hormone insulin, on a side note, actually are vital for survival. Now, hormones also communicate in another way, and this is just more direct. So this is where your pancreas releases insulin, and then that acts directly on the muscles and liver to help process glucose. So these are just a few examples, but it's important to keep in mind there are hormone receptors located all throughout your body, from your blood vessels to your kidneys to your pancreas, like I said, to your heart and to your brain. So as you can imagine, a hormonal imbalance can result in perpetuating or contributing to, or even causing, an array of physical, emotional, or mental health imbalances. And then to add to the intricacy of this regulation of the hormones and their system-wide effect, we have various factors that influence hormone levels. Now, these include things such as your lifestyle, such as if you're sleeping well, if you're getting movement in, that impacts hormonal output. Stress, food and how you nourish your body. Toxic exposures can cause hormonal havoc. Your microbiome, right? The little gut bugs in your belly that actually help to process and recycle different hormones, especially estrogen. And you actually have a microbiome on your reproductive glands. There's little bugs there that do different things and help with communication and your reproductive organs to your brain and throughout your body. There's also genetic variations in how hormones are produced, how they're transported, how they're detoxified, and how they're eliminated in the body. So examples of these that you might have heard of in the internet is MTHFR, which is related to folate, COMT, which is related to how your body breaks down stress chemicals and hormones, and some specific other genetic variations. Also, your prenatal environment and adverse childhood events, those actually can signify how well you are regulating your hormones. And if you have old traumas, that is kind of keeping score in your body, that'll impact your stress and hormonal output. Relationships and social connections impact hormonal output. We know the benefits of a hug and how that can release oxytocin, which is a hormone. There's also infections and blood sugar balance. All of these are different factors that influence hormonal levels. So there's these web-like links. And this is why it's important to address the whole person using a personalized approach when addressing hormones. Because if the foundations of health are missed, you can see where there are many different triggers, and it's going to be hard to just try to balance hormones when all of these different connections are interlinked. It's much easier to kind of allow your body to do it naturally and to allow these feedback signals to do their thing in their most efficient way. Now, otherwise, what happens if you just give hormones? You're chasing just laboratory levels and the symptoms may not effectively resolve. So we've looked at the system-wide effect of hormones. We've looked at the factors that influence them and the two different ways that hormones communicate. Now I want to talk specifically about how hormones and mood are connected. So many women probably know from experience that their mood can shift throughout their lifespan and it co-occurs with their menstrual cycle. So it probably comes to no surprise that sex hormones influence brain signals, and they also have an overall effect on brain functioning. Specifically, estrogen and progesterone have intricate interactions with brain neurotransmitters, including serotonin, GABA, glutamate, and dopamine. And they also affect nerve pathways in the brain, playing a role in brain communication. Specifically, estrogen and progesterone have been shown to regulate brain neurology and neurology. Now, for you fellow geeks or people that want to know more, this is specifically the way that they impact neurite outgrowth, synaptogenesis, dendritic branching, myelination, and other important mechanisms of neuroplasticity, which is again just a fancy way of saying that these specific hormones actually have an effect how the nerve cells in our brain are wired together and how they communicate together and how that affects and impacts our behaviors and mood. There was a cool article that is linked in the article that I wrote on how sex hormones affect neurotransmitters and shape the adult female brain during hormone transitional periods. And it really goes into detail if you want more of these, but it explores these numerous interactions between the neurotransmitters and the link between these hormones and cognition, emotions, and mental tasks and processing. So it's pretty cool if you want to dive into it, or you can just kind of look at my summary and take my word for it. Now, what about other hormones and how specifically do they impact mood and mental health? We have estrogen, we have progesterone, we have thyroid, we have testosterone, we have oxytocin, and those all affect the brain, right? So I did actually a whole series on this exact topic. It was a 3-part series. And again, there's links in the accompanying article to this video. So in part 1, I talked about the connection between stress and how that impacts hormone biosynthesis. Think of the HPA axis, that medical jargon. The many aspects of the factors involved in hormone regulation, which I kind of went over already in this video. That's in article 1. And then I introduced this concept of the interaction between specific neurotransmitters that impact mood, cognition, and psychological processes. So we've also gone over that too. So there's kind of more of the stress impact on neurotransmitters and how that affects the brain in that first article that we haven't covered in this video. And then the next 2 articles are more specific. The second article talks about the interactions between estrogen and progesterone and specifically how they impact serotonin, GABA, dopamine, and glutamate. It talks about estrogen and progesterone and they're linked to psychiatric disorders, including anxiety, depression, and OCD, obsessive compulsive disorder. It talks about the caveats of hormonal replacement to treat mood disorders. Again, this is the negative ramifications of not addressing the root cause and only addressing levels of hormones without looking at why those hormones are at an imbalance. And then I talk a little bit about naturopathic solutions to achieve optimal estrogen and progesterone levels. So this is by someone actually looking at all those lifestyle factors and all the things that influence hormonal production, utilization, excretion, as well as transport, and that lead to these hormonal balances, addressing them, and then seeing how the hormones level out, and if necessary, using either herbal or natural methods to help hormones maintain optimal communication and function, or maybe using bioidentical hormones or hormone replacement therapy. Now, in part 3, I talked about thyroid hormones and how that is crucial for brain development and the functioning of the central nervous system, the brain-thyroid interactions that occur all throughout life, how thyroid hormones impact adult psychological and cognitive states, and then the studies that are mixed related to using thyroid hormone for mood. And this is another example of why you want to treat the root cause and not just levels on a lab to address symptoms. I also talked about naturopathic approaches to treating thyroid hormones, which is a similar methodology that I talked about for estrogen and progesterone, the interaction between testosterone and specific neurotransmitters, studies exploring how testosterone impacts emotional regulations in men and women. And again, this isn't necessarily making one more aggressive, because there's nuances to that and what their levels were like before. And again, all those different factors. And then there's conflicting results as well in oxytocin, which is that hormone related to bonding, social connection, and the use of that for mood and psychiatric disorders. There's been studies for schizophrenia, OCD, and specific for autism. So if you want to go dive deeper into those, again, the links will be in the video description, and you can look, say, if you're specifically interested in estrogen or progesterone or thyroid, how that impacts the brain. Some pretty cool connections there. I gave the best that I could in an overview with the summaries in the article as well as in this video. So I hope that is helpful. And I just want to reiterate again that the studies, as well as my clinical experience, has shown that just addressing hormonal levels from a lab is not going to effectively help someone with symptoms. You have to look at the underlying causes. And this is the interaction between lifestyle and environmental factors and genetics, as well as personality type, biochemical individuality, which is a fancy way of saying how people process different foods, how they process life, emotions, all of that impacts how someone will do on a treatment. Now, hormone replacement therapy may work when someone has a legitimate low level of those hormones, and they also have the lifestyle factors dialed in and a strong foundation for health. On the flip side of the coin, again, many likely won't benefit if the hormone prescription is just being used as a Band-Aid and not addressing the underlying triggers that influence hormonal balance. So the cool thing is, although it can sound like a lot of overlapping things and a lot to keep in mind, this naturopathic and functional medicine approach holistically addresses the nervous system and brain health. And a lot of times the body has a way of, when it gets what it needs, balancing itself out. And the body is way smarter than any biochemist or neurologist. They are super smart, but again, we still are learning every day about science and how the body responds to different things and different stressors. I mean, literally for years, no one even knew that we had a whole organ system, the microbiome. And now just think about all of the things that we've discovered that it impacts and how that's changed our viewpoint of antibiotics and how our bodies live in harmony with different microorganisms. So integrative medicine addresses not just the symptoms, but the contributing underlying conditions. And the cool thing is, when you treat emotional and hormonal harmony, there's not only a reciprocal response in that the mood and the hormones will probably likely be better, but the factors which influence them are also shared. So again, this makes the interconnections far-reaching. It demonstrates all of the connectivity between all of the systems in the body, in the mind, and the body in general. So I hope that this was helpful for you, and I hope you have an appreciation of how hormones can influence your mood, your physical health, all of the things in your body, and it will empower you with some information. And maybe even look at, if things are off balance, a holistic approach along with your standard of care to rule out any underlying issues or potential disease processes that might need your attention to help the body gain rebalance from. So check out the link in the article for the specific accompanying article to this video. There will be the references there, and I'll also have resources for you as far as other offerings that I have, free things for mind-body support, essential oils, tons of research and database of everything you want to know about essential oils, including how to use them for hormonal balance, and additional information. So be sure to check out that and like this video so I can keep on giving you guys this information for free. If you have any specific other topics that you'd like to hear from me, I'd be happy to lend an ear and do my best to give that out for you. And also, I will be having actually some more follow-up videos now. I'm kind of doing this mood hormone connection thing. So stay tuned if this is a topic of interest to you, and feel free to share and provide your feedback. Thank you so much for taking the time to learn with me today, and for your interest in holistic and naturopathic medicine and how that impacts hormones, the mood, and your physical health. I'll talk to you soon.